Welcome to Thursday Zoom. I hope you guys are doing well. We were just talking about we were glad to be out of coding for a little bit. I want you guys to enjoy the next modules. They're fun. It's not like coding at all. It's thought-provoking, but it's not like your hamsters in your head on the wheel are not going to be like shooting fire. It's going to be more of a small pace. So it's going to be a lot of fun. Yeah, you're like, okay, Miss Marcia, how much fun can it possibly be? But funner, okay?
It is. You're gonna learn, like, this is where you're gonna actually get into like becoming and feeling like it's starting to all come together, especially for our students that have been in here for a little while, that's taken like all the other big modules that went through coding. And now as you're going forward, it's like the pieces to the puzzle is gonna start to click a little bit more.
Exactly, because now we know how to find the codes, but you're probably thinking, well, once I find them, where am I going to put them, right?
What's to do with them?
We did all this work. Now, what are we going to do with them? Well, these two modules, module 156 and 157, I want you to think of it as your externship. We don't literally get to go into a medical office for an externship, but in this particular module, you will be able to pretend like you're in a office, in a medical office. So it's going to be fun. All right, so I'm going to go ahead and share my screen. And y'all are going to be so proud of me. I don't have a video because we're not coding, and you guys know how I love my Contempo coder. Hi, Tracy. Good to see you. So let's share the screen. All right, can you guys see? So we're going to hit on some things in chapter 1 and 2. One of the things that I want you guys to really, really, really understand, there are lots of key terms in this book particularly, and they are important. Those of you who have been watching the NCCT prep videos that we do on Tuesday, you're going to recognize that we went through a lot of these key terms in our NCCT prep. Okay, the first thing that we're going to talk about is EHR versus EMR. Okay, and I want everybody to recognize that the boxers are boxing here, right? Because it's like, this is EHR in the blue and this is EMR. Y'all have to be proud of me. I'm learning so much about how to do this silly stuff. All right, so let's talk about it. The electronic health record versus the electronic medical record. Okay, there's one key factor that makes them different. There's a couple of key factors, but one that's going to indicate it very quickly for you. So an electronic health record can be created, managed, and consulted by authorized clinicians and staff from more than one healthcare organization. So EHR, more than one healthcare organization, where an EMR, electronic medical record, can be created, gathered, managed, and consulted by authorized clinicians and staff within a single healthcare organization. Make sense? And I pulled this straight out of your book. So if you've read your chapter or you haven't yet, when you go through and read, you're going to see this little chart there. So EHR, more than one healthcare organization. EMR, one healthcare organization, or a single healthcare organization. So we're going to talk a little bit about a patient encounter. What is an encounter, guys? Every patient encounter with the medical office must be tracked. An encounter is coming into the doctor's office and speaking to the doctor. You know, when we think about an encounter, sometimes we can think about, negative encounters. When I hear the word encounter, I'm thinking I've encountered a Karen, or as the people say, that kind of encounter. But the word encounter here is not meant to be aggressive at all. Every patient encounter within the medical office must be tracked. Medical documentation of the events is the easiest and most effective way, and it is required by law. Therefore, maintaining the accuracy of the health record is one of the most important duties of the healthcare staff. The contents of the medical record may vary slightly from office to office, but most records contain the types of documents in the following sections. Note, however, that there are some overlap among the categories. An insurance form, for example, is both an administrative document and a legal document, and it may contain health information as well. So can you think of what kind of documents a patient would have in the medical office? Think about whenever you go into the medical office.
Notes,
I'm sorry.
like medical notes.
Well, it absolutely. But I want you guys to think about when you go into the doctor yourself to see the doctor, all those papers that you fill out, that's medical documentation. That's building your medical record. Would you think something having your insurance filled out is important to have in the
Yeah.
medical record?
Yes.
Yeah, your HIPAA papers.
That's right. HIPAA papers, you have to assign that HIPAA.
Consent for treatment.
Consent for treatment, absolutely. Hi, Dawn, I just saw you pop up. You are popping up a little bit at a time. Okay, get a tattoo, put it on a poster, get a bumper sticker, a magnet, or just write it in your notebook. But this is what we live and breathe by as medical personnel in the front office. If it isn't documented, it did not happen. Why is that important?
Because that's to show that everything happened. If you don't document it, then it's like it didn't happen.
Right. You have to have a record of what you do, right?
Yes.
To cover your behind if something legally happens.
Right. You can't pull charges out of the air. You can't pull medical records out of the air. It has to be documented. So let's talk about who documents in the health record. Physicians, nurse practitioners, physician's assistants, nurses, and clinical and administrative medical assistants all document information in the patient's health record. So, you know, the doctor, the nurse practitioner, physician's assistant, nurses, and clinical and administrative medical assistants. So where would we fall in this? In the administrative portion, right?
Yep.
Okay. Who owns the health record? I'm just going to ask you that. Who do you think owns the health record?
The clinic or
Office.
the office.
Created it. Yeah.
Very good. The office that created it. Let's get into that a little bit. Patients' health records are considered the property of the individuals who created them. For example, a provider in a private practice owns the records created in his or her own practice. Records created at the hospital or a long-term care facility are the property of that institution. However, the patient controls the information within the health record. In other words, the patient has a legal right to access or view a copy of his or her own medical information at any time by signing a medical release form. If a patient refuses to sign the medical release form, guess what? They don't get their medical records. However, the original copy of the record never leaves the facility that owns it. The patient also has the right to request restricted access, request amendments to errors, and obtain a list of disclosures, which means who has viewed or received the information. So, in other words, the facility, the hospital, the clinic, oh, I can't, it slipped my mind. I can see it in my head. They own the physical record, the paper, the internet, the EHR system. They own all of that. The patient owns the information only. But the patient cannot have a physical copy of that unless they sign a medical release form. Let's do critical thinking together. Sherry McKinn is a patient at the office where you work. She plans to move out of state and insists on taking her original paper patient medical chart with her. The office manager refuses to release the record to her. Ms. McKinn has just faxed a letter threatening to involve her brother-in-law, a personal injury attorney or a lawyer, whose ad appears on the back cover of the local phone book if she does not receive her records within 1 week. Who legally owns the health record, and how can this patient situation be resolved amicably? Okay, so who owns the health record?
The clinic or the office.
Right, clinic, office. How can we resolve the issue? How can we resolve the issue with this patient?
Have her sign a medical release form.
Right.
It doesn't matter what her attorney says, right? She
Yes.
has to sign a medical release form. Please, 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 guys, remember, you cannot release records without a release form. The next thing I want to talk about is insurance cards. How important do you think it is to accurately transfer insurance information into a record? And how important is it to be able to pull or abstract what you need off of that card?
It's very important.
I
Right.
love this question.
It is so important because if this is wrong, you're not going to get paid. Your doctor's going to come up to you and say, okay, Tracy, why am I not getting paid? Oh, well, I didn't put the right number in, right? No, we can't do that. So we're going to talk about, and we're going to take a look at several different insurance cards. And we're going to start with this one. So up here, you're usually going to see the insurance company name. Then you're going to have your coverage type, your member name, and your member number.
And before we go further, let me ask this, Ms. Marsha, how important is it to understand and know what your coverage type is for that policy? Anybody know?
I would think it would be very important to know what your coverage is, because if you don't know,
Yeah, like the type of coverage it is.
Yes.
The reason being is because a lot of insurance companies, when they give out policies, the policies cover specific type of
Services.
services. Exactly.
Right.
So for instance, let's say that you're going in to have a medical service done, but you go, let's say you're going in to have some type of, let's say, psychology, behavioral health, some service like that, but you bring in your medical card that is for medical services and not specifically for behavioral health type of services. They will not be able to bill that claim, right? Because
Right.
that coverage type is different for the service that you're trying to actually get done. So very important to make sure that you look at that whenever you're looking at your insurance card. Is this the correct card based on the medical service that is being rendered? Is this a medical service or is this a behavioral health service? That's it, Ms. Marsha.
We use the group numbers sometimes, but not the most important information. Why would the effective date be important?
To know when the cover started.
That's right, because right, the effective date is very important because say that they're coming to the doctor on Friday, but their coverage doesn't start until next Wednesday. They're technically not covered. So they have to pay out of pocket. And you have, when you're looking at their insurance card, you need to know that. You need to look at these things. Also, I want to encourage you to begin practicing accuracy now, because there's a lot of numbers involved, sometimes letters. So you have to be very, very, very cautious when you're entering this information. Getting dyslexic on the back numbers is going to cause you a world of trouble. So take your time and make sure you're being accurate when you put this information in. Okay, so Miss Danielle was just talking about, you know, the type of insurance plan. No, I'm sorry, I misread that. So it goes here. Okay, so
I have a question.
mhm. Did somebody have a question? Go ahead, Tracy.
Me.
Okay.
Okay, I'm curious. You're talking about growth on the insurance.
Okay, Tracy, you're breaking up really, really bad. Try. Yeah, type it in chat. Type it in chat. And I'll answer it for you, but we'll keep on. Okay, so here it says, you know, whenever you go to the doctor and they say, okay, your copay is going to be $25, $15, they get it right here off of your insurance cards. Specialist copay is $25. An emergency copay is $75. And it even has prescription here. So if you go to work in a pharmacy, you're going to be able to get the information here. Member services and claim service inquiries. This is the number you're going to want to have. I'm telling you, because when Jane Doe's claims are not paying, the first thing you're going to do is call and find out why, if you can't figure it out on your EOB. So, all right, so let's talk. This came out of your book. So let's look at this. This is a medical health insurance. This looks like this is a Medicare card. It's called a red, white, and blue card. Why is it called a red, white, and blue card? Because it's red, white, and blue. So the name is John Smith. Right here is his Medicare number. Now, if you put one little e, little g, what do you think is going to happen?
It won't work.
No, you have to put it in exactly. Miss Danielle, we need the dashes too, don't we?
Depends on the system that you're inputting it in. Most of the time, if you put in a system that requires the dashes, it'll automatically put them in there for you. If not, it'll give you the dashes in between to let you know that they're needed for that system. I'm gonna say this about insurance numbers. If you are fortunate enough to utilize copy and paste, have it in your back pocket at all times, especially whenever you are crossing over information into one system into another. If you have access to copy and paste that information, be sure to do that, but just also verify that with the information that you're copying is correct.
Okay, well, Miss Danielle, let me ask this, and maybe you guys know. How would you be able to copy and paste this information if they're handing you a plastic card?
Well, yeah, if they're handing you a plastic card, you may
Just have
not
to
be
type
able
it in.
to, you'll have to take your time and actually put it in. But as you move, because you're going to put this card number in probably multiple places within a system, especially if you're working in the front. If you're working in the front, then you're not going to be putting it in at all. If you're in the back, then you're going to be getting that information from that person that put it in from the front. But if you're working...
But also too, and I don't know the answer to this. That's why I was asking you. I've never actually worked in the physical front office of a clinic, but you know, they put it through that little scan thing, right? You take a picture or you have a copy of it. Y'all know that little black thing that looks so neat when they stick it in there and close the thing and it goes zzz.
Yeah, it scans it and uploads it. It scans it. And sometimes, depending on how fancy the office is that you're working at, actually, if your scanner scans digitally and then inputs it into your chart, then you will have access to actually copy and paste it if it's a digital scanner that actually sends things electronically and digitally into your system.
That's what my sister used to do at her work.
Yeah.
She'd scan it in there and she'd have everything automatically put into the system.
Mhm.
Right. Okay, I'd like to backtrack just a minute. When we were talking about what you're actually going to find in the medical record from in an office, Lexi had a great answer. She said medical history. That is a great answer, Lexi. I'm sorry, this chat, I forget to, I'm doing better, Lexi, this time.
You good?
So, this patient has hospital part A, which started on 3/1/2016, and medical part B, 3/01 of 2016. So as we learn about medical insurances, it's going to be very important to know what part A and part B pay for. All right, this is a Blue Cross Blue Shield card. This is your member name, your policy number. The thing to remember about Blue Cross Blue Shield is most of the time, it's going to start with letters. The effective date, the copays. So you guys are getting the gist, right? This is a Horizon card. It looks different. This is actually a PPO plan because it says it down there at the bottom. It may look a little different, but it gives you the same information. Any question on insurance cards?
Is PPO private? Does that mean like it's a private insurance?
No, PPO means that the plan will pay for in and out of network benefits. Let's say you go to the physician's office and your plan states that, and this particular doctor is stating that I only take patients that are in my network. Where if you have a PPO plan, your plan is going to cover that doctor whether you're in or out of that network. HMO plans only cover the providers that are in that network. If you happen to see a doctor that's outside of that network, you're going to be charged for that service, for that data service.
And we are going to cover those things. You know, the way that we do this circle, we cover most things, but don't worry, you're going to know what a PPO, an HMO, an MCO, I promise you're going to be like, if you tell me this one more time, lady, I'm out of here. You're going to know what the plans are. Matter of fact, I'm going to make you make a note in your CPT manual somewhere about what it is. So when you're taking your test, for your NCCT and you forget what a PPO is, you're going to be able to just look in your manual and find it.
Yes, ma'am.
Okay, here's a Blue Cross Blue Shield PPO. Again, looks a little bit different, pays a little bit different, starts with the 3 letters. I'm going to tell you something funny really quickly. So sometimes you have to call insurance over a claim, over a patient, check eligibility, and you can't pull it up on the Blue Cross Blue Shield portal. You actually have to call. When you call, it's just like when you guys call. The first thing you get is a recording, right? And they want to know this stuff. Have you ever tried to tell a recording XCB? I'm sorry, I did not understand.
Tracy wrote in the chat, Miss Marcia.
Okay.
She put, my computer is lagging. When she mentioned behavioral health, wouldn't that fall under specialty?
No, behavioral health is not particularly a specialty. It's a service, but behavioral health is its own. It's its own. It's just like medical is its own. Behavioral health is its own. Specialties are like branches of medical. For instance, medical, internal medicine, endocrinologists, cardiologists, that falls all under medical. Whereas behavioral health is its own, is under behavioral health because it covers things of the mind, right? So it's not actually a specialty per se. It is a pretty much a kind of entity by itself.
Right. And for example, let's say John Doe is shopping for his plan. He knows he's going to need behavioral health because his child is autistic and they have to see a behavioral analyst. So he is going to be very intentional when he's talking to a representative about his coverage that he has to have behavioral health in his coverage. And so they're going to shop plans that will include the behavioral health.
Yeah. And a lot of what I'm seeing, a lot that's going on right now, you guys, this is why I'm saying like behavioral health is not so much of a specialty, because there are specific plans that are set aside just for behavioral health services only. Like you'll have a member that will have a commercial plan that is for medical, and then you go and run that insurance card and you see what the coverages are. And then you'll possibly see by a whole nother payer, it may not even be the same payer, that particular payer covers behavioral health for that individual, and this one only covers medical. So it's really different.
Okay, so
Thank you.
you're welcome, Tracy. So next, we're going to get into chapter 2 a little bit. I'm going to pull this over. Can you guys see our book?
I can see it.
Yes.
Okay, so I walked through this in a video, but I'm going to talk about it again. So in order to get into sim charting, and I'm telling you this now, not because I'm going to make you start getting into sim charting and doing anything. I'm telling you this now because sometimes it takes a month for everybody to get in. Miss Danielle's class, follow her instruction with that. I just want to show you. So you're going to click here. You're going to continue. You're going to reveal the access code. Well, isn't that sweet of it? Hang on. You're going to reveal your access code and you're going to copy it. I will show you that in just a minute. I want to point out some things that are very, very, very important for you to know in your book. You know, we spoke about key terms. There's a list of key terms before every chapter. Then at the end of your chapter, did you know that you could highlight in your book? You can tell that I read this because I highlighted it, right? But I just want to point out that you're going to be able to practice. See, that was the card that we looked at a while ago. Okay, it's taken forever. Come on. You're going to be able to practice those key terms in your chapter review activities. So you will have practice. I even have some Quizlets, but guys, I know sometimes the Quizlet glitches. So if it glitches, just put done and let me know it glitched, and you can study them by good old index cards. I like to write it anyway. So I want you to pay close attention and really study these key terms. They're so very important. Let's see. I'm going to go to chapter 2 because I want to point something out to you. And then we're going to move over to something more fun. This is going to be an overview of the sim chart for the medical office. You guys are going to see lots of pictures of the sim chart like this. It's going to give you step-by-step instructions. So you can follow those. And actually, I prefer you not to follow these because we don't use it this way anymore. You have a direct link. I want you to know that when you see these pictures, you're going to get to do all of this, but don't rush it. We have 40 days, this module and next module, to get through this sim charting, and we're going to go slowly but surely. Now, I'm going to do the fun thing. Launch my sim charting. Now, if you can get into your sim charting, then you can go, you can make a appointment for your kids. You can add your mom on here, your uncle, your neighbor. This is your playground. Also, make sure your pop-up blocker is turned off. Pop-up blockers off. My gosh, if we say that 1 million times, right, Miss Danielle?
Yes,
I want to
yes.
show you what it looks like. When you're sitting at a desk and you have a patient that calls, this is pretty much what your EHR system is going to look like. You're going to be able to take appointments. You're going to be able to do all kinds of different things. We're going to do an annual visit. Chief complaint is a cough. We're going to search an existing patient. We're going to go with Jan here, select. Okay, so we're going to do a appointment. What's today? 11:30. We're going to select a time, 9:45, 10:45, and we're going to save. Look at there. You have an appointment. Isn't that pretty cool? I mean, I know we do these things every day when we go to the doctor in the hospital, but we really don't know or understand everything that they're looking at. To me, this is really neat. Here, this is your calendar. This is going to be your correspondence. If you need to send out to a patient that they missed an appointment, you get to go in here. We're going to search a patient. Let's do Jan again. We're going to select, and it auto fills it. Isn't that cool? We don't have to handwrite all these things. Patient demographics. Let's see. We're going to search a patient. There he is. Remember when we talked about how important it is to put information in correctly? Look at there. This is his insurance information. He has Aetna, the guarantor, the patient. And the form repository, which has, when they ask you if you need a school excuse, you just get in there. Well, let's see. Oh, I have to search a patient again. Boy, Yan is really getting the workout today. And it just auto-populates what it can. You have to fill in the rest. So yeah, that is what an EHR looks like. That is this is going to be your externship. And we're going to get into it very slowly. Do we have any questions or anything you want to look at real quick before we get out of this?
So I want for everybody to start in my class. I'm not going to actually start introducing you to SimChart until probably like the last week in the module. Reason being, we're now in 156 and it's basically giving you direction on how to use the SimChart once we get in, like how to navigate it, where you're going to find the information that you're going to be needing in 157 in order to actually put that information into SimChart. So this module is really important. The next module, I want you guys to start mentally getting prepared for 157 because I'm going to be 100% honest with you. The work is tedious. It is tedious, time-consuming work, unlike any other module that we've ever been into. So start now mentally preparing yourself and also putting aside time to actually sit down and complete those SimChart exercises because unlike any of our other modules also, there are no daily assignments. There, you know, we kind of make them into, I have to go back and look and see, but for the most part, you're being graded on your completion of the work that you're doing in your SimChart. So the bulk of your grade is heavily relied on you completing those exercises within SimChart. So I want you to start preparing yourself for that. A lot of students go into 157 and they let time go by. You know, all of my laggers out there that let weeks go by or days go by without you going in and actually completing assignments, and then you want to sit down and cram. This is not the time to do that. You're going to drown.
Right. And the reason that I showed you SimCharting is because you're going to see lots of pictures. And I wanted to give you a reference to where those pictures actually are coming from and where they're leading to. Like Miss Danielle said, it is tedious, but I want to inform you about something. I had a student that was hired on the spot. She did a training, she did a training interview. She sat down, answered the phone, and the first phone call she had, she made a patient appointment. They said, "You're hired." How did you know how to do that? She says, "Because my instructor, we went through sim charting together, and we made sure we did every step, and so I knew how."
Yeah, the skills in there are impeccable. The skills that you learned while you're in there is necessary for the field that you're in. You're gonna definitely see this again. But again, I I've heard all the stories in SimChart, so I'm just letting you know ahead of time. We're not taking excuses. We're giving you a lot of time to get ready to get this done. And again, it's necessary. You're going to see it. You need this information. You need to know how to navigate through an EHR, through an EMR as a biller. This is going to be your job.
And you're going to learn the gist of it here. But I also want you to know you're not going to be an expert when you're done. You just are going to have the general knowledge. Remember, there's always going to be on-the-job training because every
system is different.
Yeah, every specialty is different. Every system is different. So just knowing what the calendar is or what the form repository is and what's in a form repository, what you can expect to find there, those are the things that you're going to want to really, really understand. So it's tedious, but I'm telling you guys, this, whenever you can put on your resume, special skills, can navigate an EHR/EMR with ease. Guess what? It's important because that's your externship. That's not actual experience, but it's some experience. I'm telling you, most of my students get in the door because of sim charting. They do, because they put it on that resume. You did an externship for 40 days in sim charting.
And some actual physicians or, practices that you may be applying to during the interview process, they may ask you questions that pertain to how to navigate that EHR, how to navigate that EMR system, because they want to know what your skill set is. What is your knowledge within this? This is where you're going to gather and get all that information. So be invested and also look forward to it.
Right. It's fun. Like a doctor, when you're in an interview, he's not going to say, "Hey, what's the CPT code for a tonsillectomy?" He's not going to do that. He's going to be asking you these practical things.
Yeah, because he's probably not going to know what the CPT code is for a tonsillectomy.
Nope. And you know what? They don't have to. They can just type it into their TrueCoder thing or whatever they're using, and it's going to auto-populate. Y'all are doing it the hard way.
Yeah, we've been saying that.
So do we have any questions, comments, anything we want to talk about before we get off?
Do we know when we're going to get this sim chart on our Jenzabar?
I don't know why you can't see it, Dawn. I have to figure out what's going on there because
I even logged out again and tried to look and it's still not there.
Okay, because whenever I get on to make sure that you have access to it, it says access on. But some other instructors are having some glitches too. And this is why we start early because it can be a little bit of a nightmare. Can you imagine trying to get 50 students into sim charting the first day of the module when you start sim charting? That is not a place that I want to be. So
yeah, just have overview, roster, coursework, news and announcement, resources, discussion forum, course calendar, syllabus, chat, gradebook, attendance, course information, week at a glance, and welcome.
Miss Danielle, we may have to.
She's missing her link.
Yeah, the link is not there. We may have to. I may have to go in and copy the course. No, I'm not. I'm going to call Mike Ryan and say, "Hey, can you drop that link in, please?"
Yeah, he should be able to drop that link.
Yeah, I'm gonna have to. I'm gonna get with our tech guy and have him drop the link in.
Lexi said hers is the same way.
Yeah. Let's see. I have 2 comments. Let's see. Lexi, I can't either. Mine is the same way. Okay.
Marsha, go into your classroom for me, please, ma'am, and show where the link is supposed to be. I want my students to see this too, just in case any of them are missing the link.
Yes, it's in Jenzabar.
Okay, I'm a lurking.
This is where your link should be. We're not gonna access it just yet, but everybody needs to make sure that they have it.
And what's weird is this is 15609, which is the session that Dawn and Lexi both are in, and I can access it fine. Check now.
I don't have it.
You may have to restart your computer, but I don't know if y'all saw the little red student eye, which means that you did not have access to it.
Oh, you had to turn it on.
But I did listen, Jensipar does this stuff to me all the time. It changes due dates. You guys saw that at the end of the module where a test was due like 2 days and then it turned it off 2 days before. It was crazy. So yeah, you
It
guys
does,
might
it
have
does
to,
self-sabotage.
yeah, let me double check and make sure it turned on. Yep. I promise I checked that, Dawn and Lexi. Anyway,
I'll
you
try
should get-
restarting my computer and see if it works because I made sure my pop-up blocker was off and everything.
Stacy, is it in Jensipar? Yes, it's in Jensipar. Let me share my screen. I didn't realize I wasn't sharing again. Okay, let's see. Share. Can you guys see Jensipar? Right
Mhm.
here. In the gray area.
My syllabus and my sim chart doesn't pull up anything.
I don't want it to pull up anything just yet. I just want you to know if you have the link.
Yeah, I do.
Okay, good deal.
All right. Anything else, you guys? Oh, look at the baby, Miss Danielle. You know we're baby crazy around here. Hi, honey.
Oh, there's a baby. Hi, baby.
Crystal, I have the link. Yoo-hoo! Yay, Crystal. Lexi, it says SimChart launch. Now I see it. Okay, good deal, guys. Good deal. It only took your crazy instructor to turn it on.
I have it.
Everybody has it but me.
You may have to turn your computer off and then start again.
Yeah.
So,
I
All
just
right.
logged out and logged
Ah,
back in.
no, I just refreshed it. It's there now.
all right, you guys, thank you so much for coming and spending time with us. You know, me and Miss Danielle, our favorite place to be is on Zoom with you guys. Let us know if you need anything. Have a great afternoon. And I will have this video, the link posted by tomorrow. You guys give me some time. Takes forever to upload. So, Miss Danielle, anything else? You're on mute.
Oh, yeah. Amanda wants me to stay behind. I don't know if it'll let.
It won't let you, but I don't mind staying behind for a minute. I can turn myself off. All right, everybody, the rest of you can go.
Hi.